Hello, I'm Natalia Devlin, and this is my presentation on information behavior of vaccine-hesitant adults for the course Information Users and Uses at the University at Buffalo in spring of 2021. Vaccine hesitancy is understood as delay in acceptance or refusal of vaccination despite availability of vaccination services. It can be encountered anywhere in the world, across all income and education levels, all genders, races, and ethnicities. It is often impacted by specific contexts and local factors, and different vaccination campaigns face different kinds of challenges. The research on vaccine hesitancy is extensive, over 2,000 research papers and dissertations on the topic, and it has been gaining more and more attention in the last 15 years. It is often conducted by practitioners of medicine or psychology and rarely aims to address vaccine hesitancy through the lens of information sciences. As a result, it tends to focus on persuasion of adults or parents of children needing shots in favor of vaccination. Gast and others have approached vaccination refusal from the perspective of marketing research and identified several groups on the spectrum of vaccine attitudes. The groups you see on the left side of the figure, worrieds and fence-sitters, are characterized by a lack of trust in medical providers and lack of interest in reading or watching news on health topics. It's worth noting that this study found no correlation between levels of education and vaccine attitudes. The following 5 groups among vaccine-hesitant individuals have been identified by Halperin: uninformed but educable, misinformed but correctable, well-read and open-minded seeking context, convinced but willing to listen, on a mission to persuade others. If we take Halperin's groups and overlay them with Kuhlthau's information search process model, we discover that Halperin's groups represent various phases in the information search process at which users of information experience different levels of uncertainty, moving from being uninformed and open to receiving more information to the level of confidence where additional context or details are still welcome, and finally, when someone is on a mission to persuade others, we can usually tell by their choices of words. I have done extensive research, or I have read a lot on this topic. Usually these individuals have a sense of accomplishment and completion of information search process, thus they aren't interested in additional facts. The following 3Cs model developed by the World Health Organization explains that vaccine hesitancy is affected by confidence, complacency, and convenience factors. Lack of confidence manifests itself as lack of trust in authorities, both governmental and medical. Complacency encompasses a set of factors that have to do with perception of need. If the public doesn't perceive the vaccine as necessary, they're likely to refuse. Finally, if vaccination is expensive or requires complex paperwork or extensive travel, the public is also likely to refuse vaccination. Damjanovic and others expanded the model of factors further, but in principle reviewed the same set of factors. It is worth noting that her model includes perceived access to information as one of the factors. If individuals perceive that they have received and processed enough information in terms of quantity, they have likely made up their mind whether to vaccinate or not. This again goes back to phases of uncertainty found in Kuhlthau's work and how our perception of having enough information results in the impression that we have achieved the end of information seeking process. Gast and others, the team that applied marketing research strategies to vaccine hesitancy research, conducted focus groups with worrieds and fence-sitters and identified that vaccine-hesitant consumers just want their questions answered, and they want high-quality information, free of horrific images and shaming. They don't trust brand names, but would like to see authoritative sources. Finally, some users have concerns specific to their demographic groups, for example, ethnicity. Centuries of betrayal of minorities have created vaccine-hesitant populations within specific ethnicities who have their own reasons not to trust authorities. Finally, the research in online behaviors by Guess and others demonstrated that when users are seeking out information on vaccination, they tend to get selective with their resources. It is different if users have an opportunity to encounter information serendipitously, without any negative emotions, and in fun and entertaining formats, like the HandForks video explaining COVID-19 vaccine you see on the right, or the video encouraging social distancing you see below. By producing such content and sharing it with your communities, you're likely to combat vaccine hesitancy at the root before users form perception that they have seen and heard enough. Thank you for your time.